if you are pregnant, this is your trigger warning. I recommend not watching this video. Welcome back to Gyno Files. Today's video is not going to be an easy one, and it is dedicated to Hayley Akula. She was a nurse, she was an influencer, and she recently passed away from an amniotic fluid embolism, also called an AFE. It is likely the worst of the obstetrical emergencies. Since her passing, I've had multiple DMs to cover a topic like this. I don't want to make this video to cause even more fear, worry, anxiety, or anything. Honestly, if you are pregnant, this is your trigger warning. I don't want this to make you feel worse. I truly believe that being knowledgeable causes you to have more power. Knowledge is power. So that is why I'm making this video. I want to start off by saying that this is extremely rare. There's about 2 to 7 cases per 100,000 births. The maternal mortality on this is as high as 60%. So this is a true emergency. If the AFE occurs prior to delivery, the neonatal mortality is about 10 to 15%. Many of the surviving infants do end up having neurological impairments. Okay, so what is an AFE? Exact pathophysiology behind it is not completely understood, but it is believed that part of the amniotic fluid does enter the maternal blood and gets into the maternal circulation. This causes a huge inflammatory response in the mother's body. Think something like anaphylactic shock for the mom. It usually occurs during the delivery or right after the delivery. And the first signs are going to be cardio and respiratory collapse, or a collapse of your heart and your lungs. Meaning at that point, the mother is not able to breathe. These patients feel a sense of impending doom, and then their vital signs start to become very unstable. We also see a severe coagulopathy called DIC, disseminated intravascular coagulopathy. Your heart and lung just... What's the treatment for AFE? Early recognition and intervention is going to be what is life-saving in these situations. You gotta have all hands on deck. Obviously, your OBGYN, your nurses, your techs, your anesthesiologists also want ICU involved. Respiratory, cardiologists, MFMs. You're also going to call an MTP or a massive transfusion protocol. And of course, you're going to start CPR. If this occurs before delivery, get that baby out. Get that baby out as soon as possible. Even while you're resuscitating the mother, you're getting that baby out. The goal here is to limit hypoxemia and the hypotension. This is going to then prevent ischemic consequences, such as brain injury, acute renal injury, and a myocardial ischemia. Again, I want to just reiterate, this is extremely rare. This was a brief overview, but I do hope you find it helpful. All right, I'll see you back in my next video. Bye!